Is it possible to help your child build a better brain, especially if they're struggling with ADHD? Clinical psychologist Dr. Sharon Saline says yes. But how does that process begin? Here's what she thinks.
So the executive functions are the directive capacities of the brain, and they reside primarily in the prefrontal lobes. So if you take your hand and you put it on your forehead, which I do often with parents, and say, oy vey, that's where these executive functions really come into play. And what that means is that this part of the brain is frequently referred to as the thinking brain. The feeling brain is here, and the what's considered the physiological brain or the reptilian brain is back here. And this part of the brain is the last part of the brain to develop.
And so in terms of exact skills or sets of things that kids are learning with using this part of the brain. So is that things like prioritization? What's an example?
Yes. So the reason I call it the oy vey part of the brain is because this part of the brain manages the rest of the brain in some very important ways that have to do with time management, impulse control, both verbal and emotional, planning, prioritizing, organization, motivation. All of these things are these directive capacities. And Dr. Tom Brown says you can think of it sort of like an orchestra. And I take that a little bit further, where I would say, you have each of these executive functioning skills, and they are like conductors. They all together sit in front of the orchestra, and they tell different sections to come up together.
Sort of as needed.
As needed, exactly.
So then at what point as a parent do you expect to start seeing these various skills develop in your child at a normal rate?
Right. In a neurotypical brain, just as in an ADHD brain, they develop from infancy forward. They develop at different rates. It's not necessarily a linear fashion. One of the first things to develop is impulse control. You learn to reach for something, or you learn not to reach for something. You learn to say something, or you learn not to say something.
That Marshmallow Test where kids are given one, you wait 10 minutes, we'll give you two. What do they do? Eat it or wait?
Yeah. Right. So, and they develop over time. The last executive functioning skill to develop is called metacognition. And that has to do with really understanding yourself and your relationships to other people, how you affect other people, but it also has to do with judgment. And that's important for us to know, because this part of the brain really, when I said it finishes developing, what it means is it's connected to the rest of the brain.
So everything is, woven together.
Exactly. And that happens around age 25 in neurotypical brains, and with about a 3-year delay in ADHD brains.
So with kids or adults with ADHD, how does this difference come out, and how does that affect learning?
Well, the ADHD brain, because of its physiology, and because of how dopamine and norepinephrine reside in the brain, usually what we find that there are lower levels of these neurotransmitters. Dopamine and norepinephrine are neurotransmitters. And that means that they take messages from one neuron to another across the synapse. And what's been found in brains of people with ADHD is that there's not enough dopamine, or sometimes the dopamine just moves very slowly with its little message across that gap. So that means that the process of those connections throughout the brain is happening more slowly.
And so then in a school environment, I suppose that a teacher might observe, or a parent might observe, by labeling that child like, oh, they're being lazy, they're not paying attention.
Exactly.
Is that what's happening?
Exactly. So what happens is that because the dopamine pathway and the norepinephrine pathway have to do directly with some of those executive functioning skills and affect them, what you'll see is our children who aren't particularly motivated to do something because they don't have enough of the dopamine to make them feel that what they're doing is satisfactory, to have that reward system, that loop that's closed and it's working really efficiently. You may have kids who are daydreaming and not as alert, and that has to do with norepinephrine. And so what you'll see in school are children who have working memory problems. They can't remember the directions, they forget to turn their homework in, or they may process information more slowly, even though their bodies bodies are moving very quickly. So it's kind of it's a contradiction when you see someone with ADHD and they're moving all the time, but really what's happening is the speed with which information is being transmitted along those pathways is actually slower.
And so then if you're a parent of a child with ADHD, how do you help them learn a different way to sort of navigate the school environment that's very sort of task-oriented and has a lot of expectations around you need to get X finished by 3 o'clock?
Exactly. Well, ADHD is a neurophysiological disorder, but you can treat it with medication, and medication improves a person's ability to learn the executive functioning skills, but executive functioning skills have to be taught directly. So it doesn't happen by miracle osmosis or just by observation. Children need to learn. They need to learn that I put my shoe on after I put my pants on. They need to learn that I turn my homework in after I put it in my backpack. You know, they need to learn these sequences and what they're responsible for and how to remember them. And that requires quite a bit of instruction, both from parents and from educators.
And so you wrote a book, and it's called What Your ADHD Child Wishes That You Knew. And one of the things you point out in the book is that kids really do care about what their parents or guardians think, even though it might seem like they don't. Why do you think that that's important for a parent to understand?
Well, because what you may be seeing is a lot of protest and resistance and a lack of cooperation and anger, when really what's happening for kids is that they're trying to do the best they can with the resources that they have available. It's just that they can't either A, access what they know because of having working memory challenges. They can't remember what they need to know, even though if you ask them and you sit down, what was the right choice, they can tell you. So they can't access what they need, they can't access their personal resources, or they may feel ashamed to ask for help, or they may not be able to make a solid decision based on appropriate information because they're moving very quickly. And so one of the things that helps parents is for them to know that their child really does care about what they have to say. Almost of the dozens of kids I interviewed for my book, pretty much all of them said that their parent or guardian was the person who helped them the most.
Wow. So there are sort of skill sets that parents and kids can learn to sort of help them navigate the educational environment.
Absolutely. And some of those skills have to do with working on motivation, persistence, and follow through. And those are things that these kids really need help with. They also, of course, need help with focusing and having work periods that have timed breaks and using incentives. So all of those things move them along in the academic environment, which is frequently the toughest area for these kids.